Hi everybody. Let me try and give you some tips and tricks on the concept map. I know everybody doesn't like it, but it is a way for us to see how well you are using your nursing judgment and how you're thinking. Now, what is a concept map? It basically is ADPI. It is your nursing process. You have your assessment, your development of a nursing diagnosis, planning your interventions, and also implementing those implementation and evaluation. Of course, see, this is ADPI. Now, I want to start breaking it down. So you start with your assessment. You have to get medical history. You get past illnesses, surgical history, all your labs and your diagnostic findings, your medications. All these play a part in finding what is wrong with your patient, okay? It's not necessarily that someone tells you what is wrong. You should be able to assess and find out what is wrong. So, when we're looking at the assessment, you are having areas where you need to look at, okay? So you have your medical diagnosis, your history, your health history, and your medications. This is the beginning of your assessment. You're going to need to know what brought them there. How long was the duration of the problem that got them there, their chief complaint? Did they do anything to make it better, make it worse? Was it what happened? Like if they fell and broke their hip, what happened? Were you like just walking and all of a sudden you fell or what? So look at that. The last thing you should have on there is what date they were admitted and what for. Now you're going to include stuff if they came in with a fever. You need to know what that what the temperature was, right? Not that they felt hot. You want to say you had 104 fever. So the health history, you're going to look at their chronic illnesses, any kind of problems they have, if they've had a history of a stroke or something like that, any kind of surgeries that they've had that could make an impact on this medical diagnosis. Now the medications, I want you to list the medications, but you're also going to, how do they impact the medical diagnosis? If I have a patient coming in with a heart attack or chest pain, and he takes an aspirin a day, then I know that aspirin is used prophylactically for heart patients to help prevent clotting issues, and he has a history of an MI. So I would write all that in with the impact medical diagnosis. There's just a review of what I said. Be sure to look at the template that I made you. I filled it out for you pretty much so you can see, have some examples. And what you'll have to do is just change your color on your font and then you're ready to go. Okay? All right. So your pathophysiology, this is what you do to show your instructor that you understand what is going wrong with the patient. It needs to be a summary of that pathophysiology, not out of WebMD, not out of Google Scholar, out of your pathophysiology book. Okay? If you have trouble identifying the primary diagnosis in a patho book, talk to your instructor and they can help you with that, okay? Plus, you're going to have your reference underneath there, and it needs to be APA. If you look on the template that I provided on the website, you will see that it's there, okay? Now, all your labs, you need to be able to put on there trends so that we can see. A normal lab is not always something we just don't want to look at. It may still be important, and there may be trending high or low, or they may be trending low in the normal range, but then going up or down. We need to see that. So you're going to need to know the action of the lab tests, like RBCs. The primary function for those is they transport oxygen in the body, and they can be indicative of polycythemia or anemia, okay? So that would be your action. Now your significance for this, if you had a patient that was post-surgical and their RBCs were normal the first day, right before their surgery, and then they had their surgery and it went down, and it was still down, but it was a little bit better, then you could sit there and say that the low levels was probably indicative of blood loss after surgery, but they are returning to normal. See, we want to see what you're thinking about this. All right? Now, you're planning. It's time to list those possible problems. This is where you're going to do your nursing diagnosis, but it's really a problem list, okay? We just want to see what's up there. So start putting up your nursing diagnoses that you can start working with. Then you're going to look and see if some of them are alike, okay, too much alike, and then you need to do something, all right? So, now this is where you're going to prioritize. Okay, so this is where you're going to prioritize. We need to see what your thinking is, what your decision making is, what your judgment is. Tell me what is most important and what is least important. Now, when you're doing it, you need to have an ANDA diagnosis, right? And you have to have the related to, and it can't be evidence, okay? So you can't have decreased, altered volume related to dehydration. You can't have that, okay? You have to have a lowered circulatory volume, as evidenced by all the signs and symptoms of dehydration. Okay? That's where we get a lot of problems. Hopefully this will help. Now, here we go into your interventions and your evaluation. We're the last part of ADPI. All right? These need to be actions, okay? They must be specific and measurable. If you're going to do I&O Q4 hours, okay, that's fine. You can monitor I&O Q4 hours all you want to. But your rationale needs to be a scientific rationale. So you need to make sure that they're maintaining fluid values or fluid volume adequately, okay? So if I had I&O Q4 hours and the rationale is to maintain hemodynamic stability, then my evaluation is going to be those I&Os every 4 hours. From 8 to noon, I had 200 in, 400 out. From noon until 2, I had 400 out or in and 800 out. Then you will look at the balance to make sure that they have relatively the same amount going in as they have going out. If you have somebody that is dehydrated, they should have more coming in than they have going out. Okay? So be specific. And your rationales need to be scientific and explain why that intervention is effective. Your evaluation needs to be the measurement of that intervention, not an outcome. Don't make it a prediction. Don't say the patient will maintain adequate hydration for the shift, okay? That's why I don't like monitoring vital signs Q shift or monitoring weight Q shift, because you aren't doing anything through that shift, but doing it once at the beginning. So that doesn't do any good for you, okay? Now, in conclusion, concept map is a visual representation of the nursing process, and it corresponds with the ADPI mnemonic. The best concept map can provide instructors with the ability to provide constructive feedback and for the student to demonstrate good nursing process critical thinking and judgment. So let me know if you guys need anything. I am here to help you out every day. So go be that super nurse that you are. Bye.